A 30-year-old motor mechanic has been worried about weight loss for the last 10 months. He has an increased appetite, anxious and disturbed by hand tremors. On examination, his pulse is 115 per minute. There is a visible prominence in front of the neck with a staring gaze. A. What is the diagnosis? B. Enlist necessary investigations. C. Give 3 management options. Answers. A. Thyrotoxicosis. B. Thyroid function test, T3, T4, TSH, thyroid antibodies, thyroid scan. C. Antithyroid drugs, beta blockers, radioactive iodine, thyroidectomy. A 35-year-old housewife presented with swelling left upper part of her neck for 3 months. She complains of low-grade fever in the evening time and lost weight. On physical examination, she looks pale. A 2 by 3 cm firm upper jugular lymph node is palpable. It is non-mobile and non-tender. Oral cavity examination is unremarkable. A. What are the 3 differential diagnoses? B. What are the possible investigations to confirm the diagnosis? C. What are the principles for managing her? Answers. A. Tuberculosis lymphadenitis, lymphoma, metastatic lymph node. B. FNOC, excisional biopsy. C. Confirmation of diseases, nutrition and hygiene, anti-tuberculosis drugs, follow up to see the response and any side effects of drugs. A 25-year-old office clerk complains of pain and fatigue in his right hand after prolonged desk work. On examination, his right radial pulse is weaker than his left. There is firm prominence on the right supraclavicular fossa. A. What is the most likely clinical diagnosis? B. Which simple routine investigation can give support to your diagnosis? C. Outline the treatment. A. Symptomatic right cervical rib. B. X-rays cervical spine and chest. C. Extraperiosteal excision of the cervical rib together with any bony prominence from the first rib. A 70-year-old diabetic female presented with swelling of the right arm after prolonged itching. Her arm is red and painful. She has a fever with chills. A. What is the diagnosis? B. What are the components of management? Answers. A. Cellulitis of the right arm. B. Appropriate antibiotics. Proper analgesia, rest of the arm icing. Elevation of right limb compression with elastic bandage. Enumerate. After getting a multivitamin injection in her left upper arm, this 40-year-old housemaid came with painful swelling of the left upper arm for the last 2 weeks. She has a fever with rigors. The swelling is 8 by 8 cm red hot, tender and fluctuant. A. What is the clinical diagnosis? B. Outline the best option to manage. C. Name an important investigation which can bring complete resolution to the problem. Answers. A. Injection abscess on the left arm. B. Incision and drainage of abscess with secondary wound healing. C. Pus for culture and sensitivity, a biopsy of the wall of the abscess cavity, and X-rays left arm to rule out osteomyelitis.